Hey, Dennis, I'm good. How are you? I know. Uh, we definitely did. I am Upper West Side. Hello, my wife is here with my dog. We're all self isolating. So it was the timing was kind of curious. So my wife is Italian, and she's been closely monitoring the situation in Italy, and so she's much more aware of the threat the virus poses, and really seeing it firsthand with her friends in Italy. And also, she's a PhD in science, so she really understands the science behind this a lot better than I would say the average American. So she was really urging me to be very, very um, proactive in protecting ourselves. And so I made the decision to close my office um, on Thursday of last week. So my last day in the office was Wednesday. I spent Thursday at home. Friday night, I came down with symptoms. I had a fever, chills, a heavy, dry cough. Basically, I had all the key symptoms except shortness of breath, which I'm grateful for because that's the sign that you have a serious respiratory problem. Um, and so I hunkered down, and Saturday was I was rough, but I took Tylenol, and by Sunday I was feeling better, and the fever had dropped. I was coughing much less, and by Monday most of the symptoms were gone. I did not. So I emailed my primary care provider over the weekend to find out what I should do. And they told me I didn't qualify for testing because I didn't either travel to one of the high risk countries, or I had not come in direct contact with someone who had tested positive. Then I found out on Monday that the WeWork that I have an office at, someone there had tested positive, and this person worked on my floor. And ironically enough, their last day in the office before they got tested was my last day in the office, Wednesday the 11th. So it's more than likely that I was infected by that person. So I called my doctor back and I said, hey, listen, I have come in direct contact with someone who tested positive, so I meet the criteria. I was then told that the standard had shifted and that they were now only testing people who had acute symptoms, meaning they needed hospitalization. And the reason for that, and this was really troubling to me, was um, the doctor told me that there is a national shortage, and particularly in New York, of protective gear for medical workers who are doing the testing. And because of that, they have to strictly limit the number of people they can test. And while I understand that for the safety of the workers, that's a big problem for the country in terms of our ability to know how quickly the virus is spreading. We are massively under testing our population, and I think that is a big part of the reason why the effectiveness of social distancing hasn't really kicked in, um, and that's because so many people don't see the effects of the virus. They see the numbers are so low, they're not scared by it. And if we had better testing and they saw how many people were infected, I think it would have a dramatic effect on adjusting people's behaviors. I was a little worried, but I also recognize I don't have any underlying conditions. I've always been pretty healthy. I was primarily just concerned, frankly, for my wife and our dog. I didn't want to infect them. And to be honest with you, so and it became pretty clear by Saturday that my symptoms were going to be pretty mild. So I wasn't that scared, but I also was. Um, Conscious of the challenge it would be present to stay in our apartment with my wife and keep my distance and limit my contagiousness. Well, according to my doctor and the CDC guidelines, that you're supposed to wait 2 weeks until your symptoms after your symptoms have died down. So I'm going to do my best to abide by that, and it's not going to be that hard. In large part just because we were going to practice you know uh, social distancing anyways. So at this point, it just means I can't go for a walk in the park. I'll live. They didn't say that. Actually, a friend forwarded me an article from Forbes by a medical professional who said there is some anecdotal evidence coming from Asia of people who had um, reoccurrences. So my impression right now is that that is an unsettled question. I think most people believe that the risk of it is low, but to say it's impossible, I don't think we can say that yet. No. So I have basically isolated myself in our second bedroom, and I shuttle between here and the bathroom. And I my wife keeps her distance, and so far so good. It's quite possible though that she traveled to cover. She's a journalist actually. She traveled to cover the presidential primaries in South Carolina, and then on Super Tuesday in Texas. She may have been exposed to it already. She may be a carrier who just doesn't have symptoms, and that happens. It's not a coworker. I work in a co-working space, a WeWork, and it was another company who had a worker on my floor who tested positive, but I don't know who they are. Um, Yeah. Well, I have a couple very close friends who are ER doctors, and they are very, very, very concerned about what's about to happen. And they're employing people like me who, have access to the media to spread this message, which is basically just to follow the CDC guidelines, practice strict social distancing, do not go to public places. If you need to go out, limit your actions. To going to the grocery store, maybe going to the doctor if you need to pick up prescriptions, but otherwise, stay home as much as possible. Don't go to restaurants. Don't be in positions where you're going to get exposed to lots of people. And then, secondly, to be conscious of the elderly in your community, in your neighborhood, and to be in a position to try and help them because they're the most at risk and they're the ones who need to be sheltered at home. Oh, thank you. Well, my love to everyone in Connecticut. Please stay safe and protect yourself. Okay. Well, actually, not really so much anymore. I launched a ghostwriting agency several years ago, and that I've kind of phased out my political work. So that's my full time work right now. It's called Gotham Ghostwriters. So I still do some political commentary here and there, but if you want to identify me, you can say I'm the founder and CEO of Gotham Ghostwriters, a ghostwriting agency. Thanks, Dennis. Stay safe. Hope this was helpful. Bye bye.